Today we're going to talk about a novel minimally invasive treatment for chronic plantar fasciitis. Previously, the only available treatments were surgical releases, resulting in longer recovery times for patients. TenJet, developed by Incision, utilizes high-velocity saline to preferentially debride diseased fascial tissue. This has been a game changer for my practice, allowing patients faster recovery time and return to activity. The whole procedure takes about 15 minutes and can be done in the outpatient setting.
Prior to the procedure, the patient is prepped and draped in a sterile fashion. The procedure is performed under ultrasound guidance to visualize both the pathologic tissue as well as the positioning of the TenJet device. A layer of ultrasound gel is applied to the probe below as well as on top of the cover to increase the transmission of sound waves. As I scan the plantar fascia, I first visualize the pathology with a short axis view and then confirm the same pathology in the long axis view. Commonly, the area of diseased tissue is found at the anteromedial calcaneus where the plantar fascia inserts. As you can see in this patient, there is a thickened insertion of the plantar fascia as well as some hypoechoic or black fascial tissue at that insertion on the calcaneus. This is the area of diseased tissue and the pain generator. To mark the location of my approach, I use a sterile marking pen. I find it easier to approach the medial aspect of the plantar fascia. Alternatively, you could use a more proximal approach or distal approach, but this medial approach provides the least amount of postoperative pain for the patient since they will be walking after the procedure. To ensure that the patient has minimal discomfort during the procedure, a local anesthetic is administered to the affected area. As I administer the anesthetic, I follow the needle down to the insertion of the plantar fascia under ultrasound guidance and anesthetize the area. Using an 11-blade scalpel, I make a small stab incision down to the insertion of the plantar fascia to create a pathway for the TenJet device. Once I have created a pathway with the scalpel, I can guide the device down to the pathologic tissue while visualizing the tip under ultrasound. Once the device is positioned down to the insertion of the plantar fascia where the diseased tissue is located, I depress the foot pedal to deliver high-velocity saline to debride and evacuate the diseased tissue from the site. By moving the device in an axial plane, I can reach and debride all the damaged and pain-inducing tissue. One big advantage of TenJet's 3-inch needle length is that you can work on the medial plantar fascia as well as the lateral plantar fascia through one incision. This lessens the amount of postoperative pain for the patient. As I work in this axial plane, there's a tactile component to the procedure. Initially, the diseased tissue creates some resistance, but as I continue to motion the device back and forth, you can feel a decrease in this resistance. As you can see on ultrasound, there is also less black or hypoechoic fascial tissue, which means we are evacuating the diseased tissue. Since the procedure is performed through a stab incision, there are no need for sutures. Steri-strips are placed over the incision and covered with a tegaderm. The patient is then able to be discharged from the procedure room and return home.
As you can see, this is a quick and simple procedure. Post-operative care can include a walking boot, physical therapy, but many patients experience relief within the first 2 weeks of the post-operative period.